All right, welcome everybody. Welcome to Transcendental Waves. I am Michael Burrows.
And I'm Jeff Bailey. And Michael, today I kind of wanted to go on a little rant. I, I'm, as you know, type 1 diabetic, and I have to have health insurance to survive in this country. And at the beginning of the year, switched my insurance because the plan that I had the prior year was no longer available. And, you know, it wouldn't bother me that I have to pay the amount I pay to survive. Um, it's usually just a few $100 a month. It's like an extra bill I just have to pay. But normally my medications are pretty affordable. It's just a had to go through hoops and hoops and found out that none of the medication I used was covered by this new company. They said it was, and all of this and it's just like lies or red tape you have to jump through to get medicine in this country. And I look around the rest of the developed world and realize that even there's half these places don't have what we call privatized insurance. It's just like free health care. And they don't have long waits. All the stuff that we were told were negatives just don't really exist out there in other developed countries. And we we spend basically the same amount of public expenses in healthcare in other countries as almost all other developed countries, and then as far as private, we spend quadruple the next closest country. And it's not that we're getting better healthcare, it's that all the same medications here cost more than they cost everywhere else. And I just struggle to find the reason why. And it's just been like until I was a slave to that system when I became diabetic, and I 100% believe that the food they feed us is causing a lot of these illnesses we're getting. And so it's just I'm pissed off about it. And I don't understand how we can let sick people just something like that just all of a sudden put somebody into poverty.
Yeah, I've known that, for a while. And then I got the medical stuff in the army. So I got to run a hospital for the government. And it was seeing how, things are bought, expenses versus, revenue and things. Then I became, one of the guys that goes to the VA. So it's like I got somewhat of, I guess, what you call socialized healthcare. Now, when you're outside the VA, and some people even in the VA say it's not that great. I aside from surgeries, to me, it's awesome. It's the best healthcare I've ever seen in my life. Uh, then I own, a therapy business that works with Medicare and the VA and stuff. And you see all these contracts and rates and then the laws and the regulations. And it gets into so silly of things where, like, if you are doing physical therapy in a pool, if Medicare's paying for one of those patients in the water, everyone else in that whole pool has to be under the supervision of that same physical therapist. You can't just have someone doing their own therapy, and it's so retarded. And then that's just like one little aspect, but you see all the aspects are as equally dumb.
Yeah, they just make up rules and regulations to prevent people from being helped.
Yes. And now that I travel internationally, I meet all these people from all over the world. And not only do I watch the podcast too, where people are just amazed and shocked at what Americans receive for how much they pay. They're all just baffled. They look at it, they think we're stupid. And I guess we have been duped.
It's
And
like America pays 10,000 per person in healthcare a year, and the crazy thing is it's not a to to play the victim or to be oh, woe is me. The I mean it's there's just
it's propaganda, man. We've been lied to. How many? before I looked into this, you guys go look into the wait times for stuff. You've been lied to say, oh, socialized countries, they got to wait forever, so they end up not getting it, and the quality of life's worse than America. Y'all, it's bullshit. It's all lies. Go look at the quality of health and the quality of life for people. They're getting the things they want, and they don't have to pay. They don't go into debt. You know how many people go bankrupt in this country because of medical bills?
Well,
They-
they talk about like you're getting like cancer medicine or HIV medicine or insulin's one, and it'll be like $3, $8, $10 in like Canada, Sweden, and then
in
like come
almost
to
every
America,
developed country.
it's like hundreds of dollars for these things. It's more than like 1,000% markup, and it's just like
Other
our
governments
tax
don't allow.
dollars are paying for a lot of these medicines to be made. The
Right,
companies
with research grants and
yeah,
stuff like that. And then other governments don't allow the pharmaceutical companies. They say, hey, this is what you're going to charge everyone in our damn country.
yeah, this is
Our
the price you pay.
right?
Yeah.
United States don't do that. It's like, call it capitalism or a free market. I mean, it's more like free to take advantage of the people.
And a lot of these like people that are working hard and doing things are just like most of America is one medical emergency away, insured or not, from just
Going and
emptying out their savings, going
wiping it all
bankrupt.
out. Right. Right. Most Americans don't even got a couple $1,000s in their bank account extra. And how much does an ambulance ride cost?
Oh, it's a couple $1,000s.
It's a couple $1,000s now. Dude.
Yeah.
In other countries, it's free or $50. I mean, it it's just mind blowing.
Well, we claim, to be the best and have the best, and then you look into like, I mean, do we have like, okay, we spend the most. Do we have the most technologically advanced equipment? It's like, no, we don't have the best equipment. We're years behind most of the Scandinavian countries. We're years behind them. Like in a lot of these lists, we're like near the bottom of developed countries if you look it up.
Healthcare systems, America is so far behind with developed countries. Guys, we are not leading the way in healthcare. I mean, really, the only thing we're leading the way in is war. And all this money that are thrown into war, just think if we put down the healthcare system.
Exactly. Yeah, that's a thing. There's like models out there that show that
Dude,
I mean, we would be spending less on healthcare per person if we spent more on taxes and just had free healthcare.
Okay,
Right.
so even in the past 10 years since I've been in this aquatic business, I've helped people do amazing things again. So a lot of times people will just come to me and talk and say, "Oh, we've traveled to other countries to try these new things to help." Like all the cutting edge stuff is not even done in America. People are leaving this country. Now these are just regular everyday people. Rich people, like when I was in Dubai, the hospital looks like a Jetsons hospital. It's so futuristic, and there's not even sick people in that whole country.
And the crazy thing is okay, so like, and don't get me wrong, I've heard of people like from America being like, "Oh, well, I got hurt in Italy and the healthcare system didn't help me." It's like, yeah, but you're not paying taxes, bro. Like, it is different for you. Like, that is a thing. Like, the people that are their citizens, like,
Better than guests of their nation. Okay, so that's another thing. People are saying, "Oh, we can't do free healthcare, socialized healthcare is free." No, it's not free. Everybody's out here working. It's like, hey, maybe if you have a job, you shouldn't have to pay for insurance just to make sure that you can keep working.
Yeah. So if you get hurt, you can be taken care of to keep working.
Right. Maybe even your taxes or the country can take care of you, just to make sure, hey, yeah, you can be healthy enough to work.
And like, I mean, while I was, fuming and looking this shit up, it's like I also see that like, among the working class Americans, the average life expectancy's going down. Like we're seeing people that work are seeing the doctor less often. Like they're like,
Dude, plus the stress from their jobs is probably adding to their death.
It's life expectancy is like for rich people is still going up in America, but like there is a portion of America that is like,
and it doesn't matter if you're
working class.
You're right. Whether you're middle class, poor, upper class, if you're working, your life expectancy is going down.
Yeah.
And that's just interesting to think about. It just shows all those studies about stress and depression are true. And we're the most depressed country too. We got the most stress. And you wonder why. Maybe it's because every system that you look to for support is lying to you. Like,
Yeah,
and I'm talking about all of them. We don't have to name them specifically, but we could.
I mean, it is, man. It does feel like a lot of the things, like, we've been told were a lie. And to me, like, the healthcare system, I kind of always knew was like a scam, but I just didn't realize that, like, it wasn't a scam everywhere in the world. Like, to me, once I
Right.
like started like looking all this up and just realizing that, like, damn, we don't have. We're not really number one in anything. We
Right.
get like we have the least amount of like
Yo,
time
yo,
per
other.
doctor visit, like the least amount of doctor visits. We spend like it's like we get the least return on our investment,
Do you
and
know
it's
what
just
else
like
we have the least of?
what?
We have the least time off from jobs out of
Yeah.
any developed country in the world. No wonder we're just fucking sick and tired and broken. And here people are drinking energy drinks and coffee and caffeine and smoking cigs and stuff and doing drugs just to stay alert and to stay motivated to work.
To keep working. We have the most cases of medical malpractice out of any of those developed. That was the one thing that like
Yeah.
was like,
Our
oh yeah,
doctors
duh.
make more mistakes than any other developed country.
Yeah.
Guys, if you still think America's number one, open your eyes.
And it's the fact of the matter is like we are putting the most money in. So like
Where's
what
that money going, right?
exactly, we just got to hold these systems more accountable and like really just like look at where our money's going and why why these things are happening. Why is life expectancy going down? Why do we have cancer rates going up? Why is there way more endocrine system diseases popping up, heart rate diseases? Like, I mean, there's this. I mean,
Right. All diseases are getting more common in this
and these are
country. In this
forever
country,
diseases
and
that
this is not in every country though. In some countries, these diseases are going away and getting less.
yeah, and it has a lot to do with our food. I mean, we just got to start paying attention to like, I mean, what we're eating, what we're doing. I mean,
It's just, guys. I used to be just like y'all. Believing everything was working out just fine, and this was going to be the best it was, and that we just got to wait for Jesus to come back, and the world's a sinful place, and it is what it is, but it's not. Other places are doing so much better than us, and we're just used to the shit here in this country of the politicians and the churches and the organizations taking advantage of the people.
the resources are available once you step back and like look at what's happening. You just realize that we're very wasteful and inefficient, and everything that we need to be happy and healthy is there. We just don't allow people access to it.
And the cool thing is, like, every generation is seeing this more and more and more.
And we're getting closer and closer. We're winning the fight. I mean, this is why we're doing this. We're telling you this because we know you're smart enough to start digging into this stuff and looking into it and start to make a difference in your own way.
Because at the same time, a few years ago, I just stopped watching the news and all these stupid shows on television, and Bachelorette or just whatever Netflix been watching, and I started like doing research and looking into statistics of what countries was where at and why they were the best, and call them conspiracy theories if you want, but you started looking into that kind of stuff, and then you just realize, wow, maybe it's not a conspiracy. And it's not just one thing. Now it's like everything. Some people's like, oh, that's a conspiracy. You just look the other way. You just like,
Maybe I'm sick and taking all these. Maybe there's most of America is taking forever medicines for a reason. Like, and it's not because they want to keep us healthy. You didn't need a statin before you had heart disease. It wasn't because you had a lack of that pill. You got heart disease because of the poison they're feeding you, and that medicine keeps you alive long enough to keep eating their poison that they're selling you. Yeah, I mean, that's all it is to it. It's a vicious cycle. They never want to cure anything. Like, I mean, I'm currently trying to like research into type 1 diabetes a lot. Like, most people will say that it's incurable, but I mean, I found a few different things out there that
There's stories out there,
yeah,
right?
yeah, and
And
it's
and
just like,
and that's what you have to do for every single thing. There are stories out there of people overcoming it.
yep, and they just want us on these forever medicines, man. Like,
Yeah, and it doesn't have to be that way.
just watch. I mean, the Tucker Carlson does the Ozempic thing with Callie Means. You can check out that Callie Means. A lot of his interviews are really good as far as like how corrupt the healthcare system is. I mean, guys, this is not just like crazy conspiracy theories. The healthcare system does not want us healthy. Like,
Right. A customer cured is a customer lost, in the system that we have now. Oh, man. And it's so sad.
and that's because it's a for-profit system. If
Right. Like other countries don't have for profit systems for healthcare. I mean, people shouldn't be getting rich off of a healthcare of just keeping someone healthy enough to keep working and being alive.
Yep.
It's kind of ridiculous to think about it. Like, what kind of asshole would make money off of a sick person or an old person? Damn, when you think about it that way, there are a bunch of assholes out there.
Yep, there are a lot of people that do not mind making money off of other people's suffering.
Right.
When it comes to medicine, war.
And we're taught that that's a good thing.
Yep.
Shit. Oh, man, I'm just having a brain aneurysm
There's,
right now.
I mean, and it would talk about like, healthcare, but I mean, we could talk about a recession and stuff, the way those things are created. I mean, that you're talking about profiting off suffering. Economists talk about the best time to make money is when there's blood in the market. And it's just like the whole capitalist system is set up on when shit hits the fan, be ready to capitalize on other people's suffering.
Right,
Like, when the market collapsed in 2008, BlackRock jumps in and buys all these foreclosed houses. It's just like every time, like,
every time there's a recession or a depression, the rich people get more, right?
they get a bigger piece of the
It's
pie. No
every
matter what
time.
size of the pie is, they get their bigger percentage of it.
And they might say they don't want it, and they do everything they can to stop it, but it still ends up happening. They make a fuckload ton of money.
Yep.
So it's like, which one? Have you ever heard actions speak louder than words?
Yeah. Follow the money, guys. Man,
Right.
follow the money.
Like, follow the actions too, not just from this, but with people in general. Man, people will tell you whatever you need to hear, but their actions, that'll show you what they're doing.
Some people want you healthy and happy, and some people want to capitalize off of you.
It's almost like marijuana. Like until 1928, that was like the most used medicine in the whole country. And then overnight, it was illegal and banned. But now we got doctors coming around, 100 years later, we're finally like rising up, being like, no more of this shit.
Yeah.
Crazy.
Well, guys, it's been good talking to you. Like, comment, subscribe. Help keep the transcendental waves a moving. We love you.
Yeah, give us some questions about some healthcare questions. We can do some research on that. We love it.
Yeah, I love it.